Hey Carson, I'm Sam McConnell with Arthrex. How are you doing today?
I'm great. How are you?
I'm doing good. So have you had a busy day?
It's been pretty busy. We've had a good amount of surgeries this morning, some elbows, some knees, but they all went pretty well, so that was good.
Nice. So I'm glad to hear that your procedures went well. Is the rest of your day pretty smooth sailing?
Yeah, it's only a few surgeries later today. We like to stack them early in the morning, so.
Nice. Well, I'm glad to hear that. Well, I don't want to waste too much of your time because I know you've probably had a long day and everything. So I'm here today just to try to learn a little bit about you guys and your ACL repairs and how Dr. Grady likes to do things. So if you don't mind, I'm going to ask you a few questions for about 5 minutes or so and just kind of see where you're at, and then maybe I can go meet with Dr. Grady for about 10 minutes after I speak with you.
For sure, that sounds great.
All right, so what is it that you do here in the OR?
So my responsibilities is I am part of Dr. Grady's OR staff, so I'm very involved in operational processes and decisions, as well as like product inventory and that kind of thing. So Dr. Grady and I have been working together for a while.
Okay, so how long have you been working here?
Around 10 years, maybe a little over, but
Okay.
It's been a long time.
Nice. I'm glad to hear that you've been here for a while, and it sounds like you have quite a big role and you have a lot of responsibility.
Yes, for sure.
So what is it? I heard that y'all do a fixed loop current method of ACL repair. So can you tell me a little bit about that?
Yeah, so we use fixed loop in our ACL repairs as well. Specifically, it's the endo button by
Okay.
Smith & Nephew is what we use. We have been using it for 5 years, so.
Okay, nice. So I'm glad to hear that that's been working for y'all for a
Mhm.
while, since you've been doing it for 5 years. But so can you tell me a little bit about how those procedures have been going?
Yeah, so the procedures go pretty well. We've gotten pretty efficient at it since we've been doing it for so long. So the OR staff is heavily trained, and we usually can get through it in like 90 minutes to 2 hours.
Okay.
But yeah, we're pretty well experienced in our endo button.
Okay, great. And then you said you help with training also?
Yes, I do help with training with the OR staff.
So what does y'all's training look like?
Training is actually pretty extensive, which is a hassle on my end to keep OR staff away from the OR and training them for so long. But preparing the graft for ACL repairs takes a lot of different training, and just to make sure we use the right size loop and all that stuff. So it is pretty extensive on my part.
Okay, and then have you by chance heard of the tightrope technique before?
I've heard of it, but I do not know a ton about it.
All right, so I'm gonna fill you in on the tightrope
Okay.
technique a little bit. So what it is, it's a differentiated technology. And so we come in, it's a one-size-all-fits device. So
Sure.
that way it can save your team like 5 to 10 minutes per procedure, and it'll also save you, since you do all the stocking of inventory,
Mhm.
it'll save you some time throughout your week, making sure that you have inventory and you don't have to worry about not having the correct size of inventory whenever you're going into a procedure. So like I said, it's a one-size-fit-all device, and it goes in, and then once you've drilled through the bone and everything, you can tighten the graft exactly how you like it. And so it's a pretty quick process. It's a 4-step process. And like you said, you're the trainer and everything, so the 4 steps, hopefully it's easy for you to implement to your training team. And then actually, I don't know if you've seen, there's been some research going on with the endo button and the fixed loop method, and there's actually about 30% of those surgeries have to be retightened or redone
Really?
later on in the patient's career. So I don't know if you've seen that. I can send you and Dr. Grady the article if you'd like to maybe read
Yes,
about
for sure.
it.
Would love to see that.
But that's one thing, the tightrope technique normally has a longevity of life and lasts throughout the patient's life. So
Okay.
it's a pretty good product. And I was just wondering, could I go back and speak with Dr. Grady for about 5 to 10 minutes to talk about it if you don't have any concerns?
No, I actually don't think I have concerns. You pretty much told me a lot of good things about the product. I think he would be interested in hearing more. So I think he has a couple minutes between the next 2 surgeries. So
Okay.
if you want to head back there and go talk to him for a few minutes, that'd be great.
Okay, sweet. Thank you, Carson. I appreciate it.
All right,
Have a
sounds
good day.
You too.
Hey, Dr. Grady. I'm Sam McConnell with Arthrex. How are you doing today?
I'm great. How are you?
I'm doing good. So how's your day been going?
It's been pretty busy this morning, but procedures have been going well, so that's always a plus.
Nice. Well, I'm glad to hear that the procedures went well. Did y'all have a lot of procedures lined up this morning?
Yes, we started early this morning, so we've been here for a while, but
Okay, well, I'm sorry to hear that you've been here for a while, but I'll go ahead and get right to the point because I know you've had a long day and I don't want to waste your time. But I just came to talk to you for about 10 minutes today to kind of hear about your ACL repairs and how they're currently going and what you're currently using, and maybe see if I have a product that could be something that might be beneficial for you.
All right, that sounds
So,
good.
if you don't mind, I'm gonna ask you just a few questions just to kind of learn about y'all's situation and what's going on. So, I spoke with Carson, your head PA of the office,
Yes.
and I talked to him, and he said that y'all currently use the endo button for a fixed loop. Is that correct?
Yes, that'd be correct.
And then y'all been using that for about 10 years, right?
Yes, about 10 years. We've had pretty good outcomes with it.
Nice. So going off that, the patients that you've been treating with endo button, how has their outcomes been looking?
Outcomes are generally good. There is a few that come back for another surgery due to loosening, which is not my favorite because I also don't want to operate on people twice. I don't have to. But I would say a good portion of our patients do have pretty good outcomes.
Okay, well, great. I'm glad to hear that it's been working for your patients and that they've had good outcomes. So what is it you look for in a device when you're going to use it for an ACL surgery?
Sure. For our devices, it's very important to be time efficient. Obviously, we want to spend as little time in the OR as possible. It's also important for it to obviously work well. I don't want to have to see patients again. If I don't have to, because obviously I don't want it to look like I did a bad job in surgery or anything.
For sure.
Yeah, those are probably the two most important things for devices.
Well, great. I got it. You know, time's definitely an important thing. Would a device that maybe saves like 5 to 10 minutes on average per surgery be something that maybe interests you?
Always. I'm always interested in saving time.
Okay, well, have you by chance heard of the tightrope technique?
I've heard of it, but I don't know much about it.
Okay, so what the tightrope technique does is it's a new product to the market and it uses differentiated technology. So what we do is it's a one-size-all device, so it can fit all of your current patients that you might be treating. And I know that currently with the endo button, whenever you go into the surgery, you have to take a measurement and figure out which device you need to use for that patient. So this is where we can kind of save you some time personally, because I assume currently that your OR staff has to go back there and get the device ready once you've taken the measurements and everything and prepare. Is that correct?
Yeah, so with the graft, once I take the measurements, they have to go and prepare the whole thing, which always takes time, and to make sure that the right loop device and all that kind of stuff.
Okay, yeah, no. So what we do differently is, since it's one size fits all, it can be prepared before the surgery. So if you decide, hey, I want to use the tightrope technique on this surgery, they can go ahead and prepare it for you, so that way they can just hand it to you, and it's a quick, simple use for you. It's a 4-step process, so it's like a lot quicker. And then also, since it's a one-size-fit-all, you don't have to keep all the stock on hand. So that will free up Carson some, so he can be more attentive to you, and he'll have more time on his end of the deal.
Okay.
And then one more thing that's great about us is we often don't have to retighten it after the process. I know the endo button, there's been a little bit of research done and they've had to retighten some of them, but that's one thing that we just do not have to do.
All right.
So if you have some time, can I talk you through the 4 simple steps of this?
Yes, would love to hear it.
So here in step 1, you can see they've got the drill. It's the flip cutter drill, and they're using that to drill through the hole, through the femur, and then you want to mark the distance after you drilled through it, so that way you know where to mark it on the tightrope, so that way you can pull the button through in the correct distance.
Sure.
And then here on the second step, the tightrope, they're taking the blue passing suture and the white flipping suture, and they're pulling them through the hole. But in this step, you want to make sure that you keep some tension on it so that the lines don't get all tangled up inside of the femur. And then so you're going to want to confirm that the button is all the way through. That's where the measure that you already previously took is going to come in big, because you'll look at that measure where you marked it on the ACL and the tightening rope, and that'll help you know that the button is all the way through. And then you're going to want to make sure that the button is flipped once it's been through, because that's what's going to hold it in place and make sure that it stays tight.
Okay.
And then so in this step, you're going to hold the 2 tightening strings, and you're going to slowly pull them to adjust the graft and advance the graft into the correct placement of the ACL.
Sure.
So while you're doing this, you don't want to like pull one side and then pull the other, kind of alternate it and just go about 1 centimeter a piece on each side. So it's a pretty simple process up through here. You just want to make sure that when you're advancing the graft, you want to like get it perfectly seated where you need it.
Okay.
And then here on step 4, this is kind of after you've already done the majority of the procedure and you're kind of like tightening up your loose ends. So it's already in place. You just want to keep making sure that it's tightening the graft and get it seated perfectly where you want it. And then once you've done that, you're going to want to tighten the strings and cut them. So it's a clean like procedure and everything, and make sure that the button's placed tight so that way you hopefully do not have to go back and do anything else with it.
Right.
So it looks pretty simple here. You can see they cut the strings from there, and then the button on there is fastened perfectly to the end of the femur.
Yeah, that does make sense. It sounds pretty good.
Okay, and then so the patient that we look for in this procedure is one that has a short femoral femur.
Okay.
And so that's the like main patient that we look for, but like I said, it does fit one size all.
Okay.
So do you have any concerns with maybe implementing the tightrope technique into your OR?
I guess my biggest concern would be, like I was saying, we have a good amount of people come back who need another surgery to retighten it. And you said that you don't have to tighten with this, but I'd like to know a little bit more about that.
Okay, so there's been research done on the endo button, and about 30% of, it's mainly the older people, it kind of starts to run down and get loosened and everything. So with the tightening ropes, you can tighten it as much as you want, and it's like not just a fixed loop, it's like fully tightened to what you prefer to tighten it at. So we actually have about 12 to 15% of people. Since we're a newer product, we don't have as much testing, but there's been a good amount of testing done. And about 12 to 15% of people do have to come back to get it retightened, but that other, I mean, it cuts it in half from the current method you're using. I'm not saying that your surgeries do, but just overall the endo button in general.
Okay.
And then also, like I said, you said time's a big constraint on those days that you have 5, 6 surgeries lined up. If it saves you 5 to 10 minutes per procedure, that could save you almost an hour a day. So I hope that kind of feels like you would gain some time back if you used our device.
That definitely does feel like I'll be gaining time back, and I like to hear that it has less recurrence of another surgery post-operation. I guess I'd be interested in getting some sort of implementation of this device.
No, for sure. So what I can do is, say next Monday at around noon or whatever, could I come by your office, and I'll bring the device with me and I'll bring a joint with me.
Sure.
And you can kind of lay hands on it and get a feel for it and see if it's something that you might want to implement into your office, because ultimately I just want to give you a product that you feel comfortable using and that your staff would feel comfortable using, and that would speed up your process. And what I also can tell for you is on our website we have many videos and articles and resources that you can go watch, and then I'll give you plenty of time to practice using it before if you decided to try it out in one of your procedures. So that way I want you to be totally comfortable so you know that your patient is getting great treatment and gonna have a great outcome.
Okay. Let's plan on meeting at Monday around noon then.
Okay.
And I'd love to get my hands on the device and really see it up close.
All right, great. That sounds perfect. Well, thank you, Dr. Grady. You can keep this sheet, and I'll be by next Monday to meet with you.
Yes,
Have a
thank
good
you.
one.
Have a good day.